Um, okay, so we'll start. Good evening, everyone. So we have heart to heart today with Dr. Saroj Menon. Srila will be presenting the screen with the questions, and Dr. Menon will be answering accordingly. And if you have any queries, you can ask at the end of the session. So yeah, we'll go through the queries which were already asked in the Google form first. Yeah, thank you and stay tuned. Okay, Mama, over to you.
Good
Should I?
evening,
Sorry,
good evening, everyone. Hope you'll enjoy this session.
just starting the presentation. All right. The first question. I normally don't check my periods date, but I do get periods every month. However, now the amount of blood flow is really less. So I guess the question
No,
is that should the person be worried or
no, it
what?
depends how much it has lessened. Basically, if you've been using, if you've had the period for 5 to 6 days, if it has reduced to 3 days or 2 days, then one has to see. But every time, I mean, all your 12 month cycle may not be the same. It may change, and if it is, there is a lot of change in it, either too excessive or too scanty, then you must see a gynecologist, because maybe you're having anemia, that is, hemoglobin is less. You must get yourself checked up. If there is a difference, like 7 days bleeding becomes 2 days or 3 days, or just spotting, even if you're having bleeding only for 7 days, but it's just spotting on the pad, you should be little worried. Or if you have to use more than the normal pads and you bleed for more than 7 days, it's better that you go and show to a gynecologist. Unmarried doesn't mean that you cannot go to a gynecologist, because it's only a gynecologist who can give you the treatment. Others may not be able to do it.
Okay. Next question. There's sudden increase in hair fall just before and during the days of menstruation, and there is pain during ovulation. Is it normal?
First of all, I would like to know, how does she know that there is a sudden increase in hair fall only during the days of menstruation, before or during the menstruation? Usually, the hair fall is not connected with the menstruation. There has to be either you're having anemia, you're having a thyroid problem, or you are having weakness, or you have just recovered from some illness.
Okay.
Menstruation itself doesn't cause a hair fall. And with regard to pain during ovulation, how do you know the ovulation is occurring? Are you getting an ultrasound done? No. So that means you are having in some cycles pain, and in some cycles you do not have pain. So, yeah, I mean, the thing is, we usually say painful means it may be ovulation has occurred because there is a rupture and
Okay.
the ovum comes out, so it may be there. And
Okay.
just paracetamol should be able to help you out.
Paracetamol, is it? For
Yeah.
pain. It's like a painkiller medicine for that.
Unless, of course, if it is too much, otherwise, you need not take anything.
Okay. What is the best time to have sex and avoid pregnancy with precautions and condoms? I mean, even, you know, which is
See,
the
the
best
thing
time
is,
to have?
if you are having a regular cycle, like 28-day cycle, the mid period, 10th to 15th day, is dangerous. But sometimes what happens in excitement also, your cycle instead of 28 days may become 26 days or 30 days. So exact time of ovulation we do not know, because the ovulation occurs immediately if there is sperm. It may be the sperm may be there for 4 to 5 days after coitus or intercourse, and if one of them go and meet the ovum, you'll have. But with precautions, I mean with condoms, yes, there are no chances unless it ruptures. That is,
Okay.
the condom breaks.
Hmm. Okay. How to talk openly about sex preferences to our partner?
I think you have to talk, because unless you talk with your partner, I mean, partner means, what I'm trying to say is anyone, unmarried or married, you should put forth definitely that use of condom is very much necessary, and you should also keep a female's condom with you, because many a times the man may not use condom, but you should be using the female condom. But try to say you should be able to make the partner use condom for his own this thing, because if there is some infection in your vaginal tract, he may get it. If he has some infection, you may get it. So for both the persons, use of male condom is the best thing.
So we have female condoms also in the
Yeah, yeah,
market.
female, yeah, correct.
Okay. Okay. Could you tell a little about STD, unintended pregnancy, types of tests to detect STI, pain during sex, negatives of masturbation, and side effects of pregnancy control medicine? So
Okay,
let's start with the first one. Could you
no,
tell
no,
about
no,
STD?
sexually transmitted diseases are usually the various infection like syphilis and many others, which are transmitted while having sex. And if you are using condom, all these things which you have written will not be there, because you will not become pregnant, the infection will not be transmitted to you, and uh, the partner also realizes it, that he also doesn't get a infection, because he can also get a very bad infection if he doesn't use condom, because female condom and male condom both can break. That's
Hmm.
there. So you can have, and if a person has multiple partners, more the chances of infection. And negatives of masturbation is excessive masturbation may cause emotional problems also, and more than that, it can cause dryness of vagina, too much of handling, and it's very fragile and very soft area. So too much of masturbation can cause mental, I mean, I would say emotional and local dryness. And side effects of pregnancy control medicine, basically, the low dose contraceptives do not have much side effect, excepting nausea in the beginning, and then you get used to it. And also, like previously, the doses were, I mean, they had more strength, and they used to cause gain, weight gain was there. Even now, with the small dose one, also some people gain weight. They are, anything they eat or they do, they I mean, they gain the weight. So it depends from individual to individual, but as such, not much. And also, some people get depression with this contraceptive tablet.
Okay. And pain during sex? I think
Very
that
good to
part
know.
we missed.
To detect as pain during sex. Okay, pain
Yeah.
during sex is that emotionally you are not involved. Then that whole area doesn't lubricate well. Actually, they always say before doing sex, you should have foreplay, so
Hmm.
that the woman gets excited and then the lubrication occurs. And otherwise, one uses some lubricant like Vaseline or something, and just to make it soft and not very dry. That is
Okay.
the aim of it. And some people, if it is still, in spite of using all these things, that means there is something, either there is infection or ovarian problem, which the gynecologist, while doing the palpation, she can make out. When she is doing it, the person will have pain. Where is the pain? Whether it is at the ovarian side or whether it is at the uterine side. That means you have to go to a gynecologist.
Okay. Is it safe to wax or shave down there? And is it necessary to wax every now and then,
It
the
depends on
vaginal
the,
area?
I know, it depends on the individual. Only thing is that whether you're waxing or shaving, you can have, and more with the shaving, you can have infection if it is not done under sterile condition. That's all I can say. And it is individual problem. Some people don't bother about it, and there is nothing wrong in it. But once you start shaving and waxing, then you have to regularly do it.
Okay. So now there are three questions which were, I think, asked by the same person. Can we visit a doctor during periods and should we wax before visiting? Should we consult or have checkup with a gynecologist before getting married? And do unmarried girls need gynae checkup every year?
First and foremost, during periods, none of the gynecologists will do internal checkup because of the fear of infection. Okay,
Okay.
we all are doing with the sterile gloves and all those things, but when the bleeding is there, usually we don't do it. But if it's a condition where she is having excessive bleeding, passing clots, so we have to know what it is. We usually give them medicine to stop the bleeding or to reduce the bleeding. Then we call them and then we do the internal checkup. Internal checkup usually we try to avoid during bleeding. And should we consult or have a checkup before getting married? I don't think so. But yes, like in Iraq where I work, there every girl before marriage was brought by her would-be mother-in-law to see whether her hymen is there or not. And if the hymen is not there, she would be killed by her brother. I was
Oops.
finding it very difficult to say that there is no hymen because she will be killed and I would be the reason for that. But basically, that's their custom. So, but the Iraqi doctor herself said, you just don't say, you say no, she has, because we don't want her to be killed. But these are
Hmm.
some of the cases when you go abroad, you find that these things are being done. Then do unmarried girls need gynec checkup every year? Not at all. If you have some problem, you definitely go.
Okay, and I think we missed out on should we wax before visiting the doctor?
The doctor doesn't mind anything. Even if
Okay.
there are girls and women who come, but it should not be too long a hair. But if they had been waxing regularly, then it's better to go wax like
Shit.
that. But if you have not done at all, there is no need to do that.
Okay. My inner thighs are black. I don't know why, but really embarrassed to go to the hospital. Same with my neck. It's black in color because my skin tone is different. It is really noticeable. However, there's a situation that I have to go to hospital every now and then. Probably she is going through something due to which she has to go to the hospital. But what can she do to kind of lessen the blackening?
See
If there is
the No, no. Actually, the nape of the neck, the back of the neck, and the thighs, the inner portion of the thighs, the vagina, and the armpit, all these things are darker in some people who have more of melanocytes. Melanocytes are the one which produce melanin, which is the reason for the darkness. Now, if it is in the neck, you'll also find that the this is thick. The skin is thick,
some.
so there is a special name, acanthosis nigricans. So that is something which is related to excessive melanocyte production there. So in that case, it's better if neck and all those things are affected. Then you may go to a dermatologist. They may give some medicine, but it doesn't disappear forever.
Okay, it
That's
might
the
lighten the
uh,
but
yeah,
that only the dermatologist will be able to tell.
yeah, that's what.
Okay, all right. I
Even the
have.
knees they may have sometimes. The knees,
Sorry.
knees, good moment.
Oh, okay,
Okay.
knees also. All right. I have uneven breast, and when I was young, my mom took me to a doctor. Was that visit necessary?
It depends how uneven it was. See, usually both side breasts may not be of the same size. It
Hmm.
may be slight difference might be there. But if there's too much, that means one side is developed fully, the other side is not developed. That means it's not looking okay. Only one side, the breast, and the other side is shrunk. Then, of
Hmm.
course, one has to go and see. But this can happen if she was burnt during childhood. If she had burns, then that scars may be there. Then they have to do plastic surgery. But otherwise, I don't think so, because an inch or two less than the other breast doesn't make much of a difference. And once you start bearing children and feeding children, they become all normal. But there would be always a difference. If you see your own body, both sides may not be symmetrical. There might be some difference, with very
Hmm.
small differences. But for breast, the mothers and the woman herself is very particular. It should be nice and it should be, I mean, not very small, all those aspects. So they go to the doctor, but the doctor also would say no if she eats well, if she does exercises, if she does skipping, all those things. And
Hmm.
actually, I feel the dates which the girls do, the skipping and whatever, the langadi and all those things, they're all helping her to develop the body.
Hmm. Correct.
Okay. So the visit might have been necessary according to your mother, because she must have seen there's a remarkable difference. Otherwise, she would not have taken you.
Okay. Can you please explain how to do self breast examination?
Now, self breast examination, uh, one can do it. Actually, we say that you feel the breast from above to down, and
Hmm.
then from side to side, and then see if there is any nodule. Nodule means some thickening somewhere. If there is, then you must go to the doctor. But overall, like just when you are having periods or just before periods during ovulation time, the breast may be very painful,
Hmm.
and it may be tense because of the water retention. That's also there. Some people say, "Oh, I get so much of breast pain just before the period, and after the period it becomes all right." That because hormones are playing, and there is water retention everywhere, for that matter, in the body. And
Hmm.
breast, especially, is very tender, very painful.
Okay. I'm not able to lose weight despite exercise and diet. My lower throat seems swollen. Should I consult a doctor? Also, does thyroid medicine help to cure permanently?
Well, the description which you have given, most probably you may be having hypothyroidism. That means the thyroxine is not being liberated much. So it's better to go to an endocrinologist or a physician who will see your the levels, investigate it, and accordingly will give you the treatment. But it doesn't go permanently. So you require either the addition or the medicine which reduces. Either it could be hypothyrotoxicus or hyper. Both are it happens, and nowadays quite a lot of people are having hypothyroidism. So it is better to go to the doctor and get yourself the blood investigation, and also they do some examination of the thyroid if it is enlarged. So that will help you. But yes, you have to take the medicines regularly.
Is there any specific reason why people are getting a lot of, are having a lot of
Iodine
thyroid
deficiency.
problems?
Iodine
Sorry?
deficiency. Iodine
Oh, iodine
deficiency.
deficiency. Okay.
See, if you
So,
go to the Himalayas and all, they have lot, because there is iodine deficiency there. They all
okay.
have goiter. That is
Hmm.
hypothyroidism. It's all hanging like that and all those things. So basically, in diet, and that's why we take iodized salt.
Hmm.
All of
Right.
us take iodized salt.
Right. Right. Yes. Okay. What are the main symptoms of thyroid, and how do I know I need to see a gynecologist or a doctor for the same?
So whenever there is an enlargement of the thyroid, you should go to the physician first. And if the physician feels that you should go to the gynec, because this is not due to gynec problem, the thyroid causes gynec problem, not the other way around. So whenever there is a problem, first you, unless gynecological problem is causing a lot of problem to you, then only you will go. Like very less bleeding or too much of bleeding, you go to the gynecologist. But if you feel that you have appetite, lot of appetite, or less of appetite, all those things, that means you don't feel very hungry and all, it's better for you to go to physician. Physician will do all the investigations, and then if the thyroid is less or more, the person will give you the medicine what which is required. But it will be a lifetime medicine.
Oh, I have thyroid medicine the first thing in the morning. After how much time can I drink tea? Also, what should we consider before giving blood test to check thyroid? Like, is it fasting? Or if it is fasting, can we drink water before going to the lab for the testing?
See, it should be fasting, and after the test, you can take the tea. There is no such thing as half an hour or 1 hour or anything like that. You go to the lab, you give the blood, come back and have tea. It
So,
doesn't affect.
fasting is also without water, right?
Without
Fasting
water,
means.
without water, everything.
Okay. And after how much time can I drink tea if I'm having a thyroid medicine the first thing in the morning?
No, no, you take it. After that, you can have tea, no problem.
Okay,
See, the
immediately
thing,
after. Hmm.
you can. I mean, what? As soon as you get up, wash your face. I mean, after having brushing your teeth and all, you take the thyroid. Then you prepare the tea and you take tea. No problem.
Okay. What is laparoscopy?
Laparoscopy means like we used to do surgery opening the abdomen. It was a
Hmm.
major surgery. Now what we do is a keyhole. A small hole is made, and through that a tube-like structure laparoscope is introduced. And with that, whatever instruments, very fine instruments are introduced to take out the things and to see. Basically, we do laparoscopy to see what is wrong inside the abdomen.
Okay.
And no, but with laparoscopy, we can do surgery also. One is at the umbilicus, and the other two will be at pelvic region. So, like that, we do it. And they are trained for it and they do it. But for big tumors and the thing which cannot come out, minute ones and other things can come out, like we used to do laparoscopic tubal ligation. It's
Okay.
hardly 10 minutes, and just you can do that. But other things, if there's a big fibroid or big tumor, we cannot take it out with
Okay.
laparoscope. Then you have to open the abdomen and do the surgery. But less of blood loss is there with laparoscopy, and people now prefer laparoscopy to opening up the abdomen unnecessarily.
Okay. What age is appropriate to introduce sex education to children at home by parents?
Well, it's a continuous process. Basically, when the child is small, the child sees the organ, and especially for the boys, I find they hold it small. After some time, the penis has grown up. Hey, what is this? Yes, as you're growing up, you will find it is increasing in size. As you're increasing in height, similarly, this in length it will increase. For females, they find little hair growing there, armpits hair growing. Even for the boys, it's like that, and we have to tell them, yes, these are all normal processes of development. But with regard to sex education doesn't mean just the intercourse aspect. Sex education means the difference between the boy and the girl, and that too emotionally and developmentally. Why I'm saying emotionally? Because most of the hermaphrodites, which we think may be a male who has emotional things like female. They think
Hmm.
like female, so that means psychologically they are female, anatomically they are males, and so they cannot adjust with the males. They would prefer to be with the females, and that you can know from the young age when they are too much towards the girls only. They are fine. I mean, playing, and also the behavior wise. So
Okay.
these are some of the things which, and so the parents should introduce slowly. It's not saying that I'm giving you a sex education. Okay, there is hair in the armpit. Don't worry. That is showing that you're growing up well. Pubic area, yeah, that is normal. So slowly, slowly, I feel it is the mother and the father. For boys, I usually prefer father explaining everything, and for girls, it is the mother who explains everything. But
Okay.
sometimes the fathers don't talk. We have taken this thing. We had a workshop in which, I mean, doctors, frankly speaking, the male doctors never spoke to their son. They used to say, if the son comes and asks us something, then we will tell. But it is the mother who explains everything. So the woman, as such, you may be a girl, you may be a woman, you should know both the, because to your children, you have to explain. That is what it is.
Okay. So it can be at every stage, like you have to explain it at every stage. There's not just one
And the
particular.
child will not come and ask you. It's
Hmm.
just while talking, we just talk. It happens like this.
Okay.
Some people, like sometimes, the girl thinks, why the mother enter the kitchen, doesn't go in the room, she will ask. Then you
Hmm.
just say simply, okay, I bleed on these days, so I cannot go. Of course, now not going to the kitchen is not no more there. Very few people observe that. But puja room, many people don't go. Many people also don't observe that. Then also one must explain to the daughter when they see that her breast is developing. These are normal things. All those things we have to. They should not get scared. It is the
Hmm.
boys who get scared because when they start releasing semen, they feel they have passed urine. And I still remember one of my neighbor came running to me in the morning and said to me, "Ma'am, please come and see my son. What has happened?" And he's not getting up. So I
Hmm.
just went and I told him, "What has happened? Get up." No, I passed urine in my bed. So I said, "So why are you lying on the urine? Please get up." So he
Hmm.
got up. And then I told the mother to go out. And then I said to him, how old are you? 14, 13? Well, this is the time that you have matured, and this is not urine, this is semen. And then I tried to explain the mother also afterwards. I called her and I said, no problem, he is grown up and he's growing up. So don't be scared of it. So that's how we have to tell. The mother may
Okay.
tell or the father may tell.
Okay. How to overcome trauma from rape, even marital or unintended pregnancy?
Well, for the rape portion, marital means, first let me consider the marital one. Why should there be a trauma? Because you expect you are going to have intercourse. But if you are not prepared, you should tell your partner that I'm not prepared for it at present. Let us just get to know each other and then we'll have it. If he is a patient person and a very person who is considerate, he may for 1 or 2 days. But you also have to be, once you're married, you're going to have this intercourse. So then you use Vaseline or something so that it's not dry. Because when you are nervous of this thing, it becomes dry and it becomes painful. So the best thing is use a cream and then have it. And okay, an unintended pregnancy means that you're not using any contraceptive. You should use, there is no unintended. If you do not wish, you must use contraceptive. Without contraceptive, you can become pregnant. So one must realize that. People think, no, 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 we'll do it on a day which is not ovulatory. You sometimes cannot. Sometimes the worries, sometimes the excitement, all that can cause ovulation.
Okay.
So to overcome the trauma from rape, is just you should have good discussion with your partner, and the partner should be considerate. If he is not considerate, hell with that relationship. And if it is married, then you should tell him, no, I'm not ready at present. Yes, I know I have to have, but give me some time. He will surely give you time. That's the thing. Okay.
Okay. I have massive hair loss and it's said because of dandruffs. I have tried different shampoos, but it's not working. I believe the person wants to know what to do. What is the remedy for it?
See, dandruffs are dry scalp because of which you get it, and there is sometimes some infection. That's how it happens, and you get massive hair loss. But it may not be just the dandruff, as I said. You might have had, you must be convalescing, or you may be like the hair loss, the water is not okay for your hair. That can cause hair loss. There are many causes of hair loss. And for that, you better go to a skin specialist, a dermatologist, and he will tell you what to use. Not all shampoos will help. It is that person will tell the medical person will let you know how to get rid of dandruffs. Dandruffs are actually superficial infection and then the scales come out. Okay.
Okay. Okay. Is thick hair around areola normal?
Thick dark hair, basically how is your hair itself? That is one. Another is if your testosterone level, that is the male. We also, as females, we also have male hormone as well as female hormone. But if the male hormone is slightly more, then you may get certain features of male, like face and face will have hair, hirsutism, and hands will have dark hair. Everywhere you find more of dark hair and all those things. And when you see your testosterone level, it may be high, then they give the medicine to reduce it. So it is quite normal in people who have hairy, I mean, this is face also has, you can find out your hand also has, it's not soft and this thing, but it has some hairs, dark hairs, so that could be one of the things. But it is not normal, it's better to get yourself examined because I'm sure it will be accompanied by other things. And for hairiness, one does go to the doctor, the skin specialist, and they will give you the medicine.
Okay. What can be the cause for a constant itchy sensation within the labial folds and after masturbation the vagina becomes dry? Is it normal?
Well, dryness causes itching. That
Okay.
is one thing. And if you do excess masturbation, as I told you before, it can cause dryness, and dryness can cause itching. And constant itching sensation means there is actually the labial folds when you're taking a bath and all those things. That time, if you don't wash it properly, there might be certain deposits and which needs to be, especially fungal infection can occur because if you don't dry it properly with the wet, the same fungal infection is possibility of all the undergarments. By if you don't wear clean undergarments, then also infection can occur.
Okay. Is PCOD something which is very bad? My mother scolded me and she said she's not going to let me eat anything now on. She said you're not going to have kids if you have PCOD and you have genetics in your family. Is it true?
Well, polycystic ovarian disease is a disease of concern, especially for us like in fertility management doctors. Because what happens is the actual cause of polycystic ovarian disease is not known. But multiple eggs, they at different stages of development are seen, none of them ovulate. So there is no ovulation, and so naturally pregnancy cannot occur. And there are reasons actually if you put on weight and you are not putting on weight with by I mean if what we have seen in our cases that if we ask them to diet and bring down their weight, this disease, polycystic ovarian syndrome reduces. So fatness is associated with PCOD, and if we reduce that, and if we take proper diet so that we don't put on lot of weight, then PCOD can reduce. PCOD means multiple eggs at different sizes are seen on the ovary. To reach appropriate size, only one can grow and mature. It has to mature 18 to 20 mm, then only it ovulates. And that will be, fertilized by the sperm. But other things will be all small, 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 and they are not fertilized and they don't ovulate. So all these PCOD cases and PCOS, that is syndrome cases, will be having an ovulatory cycle. So naturally, if ovulation does not occur, pregnancy cannot occur. So most of the cases in our clinic, where I work, the mostly PCOD cases. We used to do the ultrasound. We used to find so many oocytes there, but ovulation is not occurring. So then we tell them if they are fat, we tell them to reduce the weight. Then we give medicines for that. There are medicines which we give, and with that we used to make them pregnant. So
Okay.
that the PCOD doesn't occur and only one ovum or two ovaries ovulate. That's
Okay.
it. And yes, it is familiar.
Oh, it is due to the genes, is it? It
No, it has
happens.
a genetic aspect also.
Sorry, it has a
Genetic aspect. It can. If your
genetic.
mother had, maybe you may have, but it's not.
Oh,
Maybe about 8 to 10% may have like that.
okay. How soon can women of age be approved to go through with tubal ligation? Are there any other procedures prescribed for a permanent contraception? And second is, at what age can a woman without children and who hasn't married yet go through tubal ligation
Very good.
procedure? Yeah.
Okay, first and foremost, tubal ligation is never done in an unmarried girl.
Okay.
And second is, there is no age approved. We only ask how many children she has. Because once we do the tubal ligation, she cannot have a child, but there could be an ectopic pregnancy. So we don't do it. She has 2 children. Yes, fine. Then we may, or 3 children. That's our policy. So we do that. But the thing is, a woman who does not have children, we will not do it because at present she doesn't want the children. Afterwards, when she wants, how will she get it? Sterilization is done. The other thing which I want to tell all of you is that the eggs which we have, they mature. Or, they may not mature, but in multiple oocyte and PCOD can occur and all those things are there. But more than that, we say a woman should become mother before 35 years of age. Why? Because 35 years means when we when we are 5 months or something, that time the ovum, the oocytes and all those things are formed in our body, and number of oocytes also are formed. So what happens is, it is 6 months more than our age. If it is 35, the egg is 35 and a half year. Genetic defects can occur. If that particular ovum is
Hmm.
fertilized, it has more chances of having abnormal child. So that's why we say it's better to have children by the age of 30, 32, not beyond that. But yes, there are people who have delivered children at 38 and super intelligent. That is also there. But most of them, they have some mental problem. So it's always better to have a child before 30 years. That's why in our country, most of them got married at 18, 19, 20, 22. Now only the age has increased. But we find that there are many people with mental problems
Oh,
because the egg is old. That is the thing. Sperm is always young because it is produced every 3 months. That
oh,
is.
okay. Oh. So basically, tubal ligation, unless you
So,
have two
two children.
children or probably three children, I mean, minimum two children is required. That's the
No,
time.
even with one child, and if she has some problems with the
Okay.
uterus or something like that, yes. The other method not to have children is remove your uterus. So you won't have period, you won't have children. You are free of it. But then,
But you'll have hormonal problems now.
yes. So that
That is
is
the
what
side
it
effect of
side
it.
effect.
Right.
So, okay.
Okay.
So whatever nature has given to us, let us accept it. How soon can a
Yes.
woman of age be approved to
Yeah,
do?
yeah. Sorry. This is the next question now. Can you please explain what are yeast infections and how can we identify and prevent them?
Yeast infection are fungal infections. And in vagina, if it occurs, it is curdy white discharge with lot of itching. The curdy white discharge with lot of itching means it is a fungal infection. You have to go to the doctor. The doctor will give you a vaginal suppository and that will heal you.
Okay. Uh,
Oh God, this is quite a big one.
yes, I'll read it out. So I have never had pimples in my life, but all of a sudden my face was completely buried with pimples. I visited the hospital and doctor said that I must be having some hormonal problems because I had massive hair loss and pimples full on my face. And recently I gained more weight and darkening of neck. So the doctor asked me to do some scanning and get some results. Now the results said that I had cortisol, and scanning results said that there was PCOD. So this person overheard the whoever was writing in that the ovary was 8 and 6. So the doctor, the gynae, did not give any medicine. Instead, asked to reduce fat and start exercising since I'm having regular period. So the question is it not necessary to take medicines?
For pimples,
PCOD as well as like
no,
for
we don't
cortisol.
give. See, PCOD, we give medicine only when she wants a child. Because these are all hormonal things which we are giving. And the
Okay.
whole system changes. So when they are wanting, when we are treating for infertility, we give it. Otherwise, we don't give it. And with regard to her, basically, if your body is oily, you will get more of pimples. And the acne, all those things are also there in PCOD because of the hormonal disturbance.
Okay.
See, that is why it is, and some people are prone to it. As I told you, the neck and all, they have more of melanocytes, so they will be having darkening effect. But all this comes because of hormonal irregularity.
Okay. And what is
Right?
cortisol that I have got
Cortisol
as
is
in?
adrenal, adrenal
Sorry.
gland का secret,
Okay.
adrenal gland से जो होता है corticosteroid वो वाला उसका भी level
Okay.
होता है तो उसको भी ये करते हैं. But all these things are combined hormonal problems which comes from the brain, pituitary gland, and so also stress can cause all these problems. The people who are stressed out anything, you will find them. But mostly we find in an oily skin person more of pimples and those who have an ovulatory cycle.
Okay. Um, these were the questions that were asked. I just got another question on my cell. That does PCOD cause depression often or mood swings?
See, the thing is, when you don't ovulate, the mood swings are there even during your normal period. See, when the period is just going to come, some people feel suicidal. Some people feel that they are not okay, they are not as good as others. All those things comes just before the period. Once the period is over, then you become normal. That's all
Hmm.
hormonal changes which are occurring, which causes you all these things. So we always say, if you have a positive type of mind, because everyone can get into depression, there is nothing. But there are some people, whatever may come, they don't get depressed.
Hmm.
You are feeling depressed because you feel you are not better than the other person. Don't compare yourself to anyone at all. Whatever you are, what God has made it very well for you. Always find the beauty in yourself. It's just not physical features which the people say, oh, her nose is good, her this is good, so she's beautiful. No, beautiful is from the soul. How kind you are, how helpful you are, how positive you are. Any positive person, when you see, you know, yes, this person is positive, always smiling, always giving us good vibrations. That is beauty. If you have beautiful eyes, if you have beautiful face, that doesn't mean beautiful. The true beauty lies in your soul. And that soul thing comes when you act. When the other people experience you, they say, oh, such a nice person, always helpful, always gives the right remarks. See, sometimes what happens, even in our in WhatsApp, sometimes certain people write something and we feel what the person has written, we should write. No, that time we don't say anything. You can always tell, oh, this was not for that particular, whichever is a good post, you always say, oh, it was so nice, I enjoyed it. But if you did not enjoy, you need not say you didn't enjoy. Why make that person this thing negative? You just leave it. It's not necessary that we have to comment on each and every this thing, remarks or whatever the comments they have written. So I always feel it's always nice. If you just see a smiling person, you feel so happy yourself. So be happy and make others happy. That's my motto.
So
That's all.
basically, I mean, the depression is not a form of like PCOD. It can happen
No,
to
no, it's
any. No.
no. PCOD में ज़्यादा water retention भी होता है और
So
pre
that also causes mood swings. That also causes
that
depression.
also causes depression.
And does it also cause dark eyes, as in the darkness under the eyes?
See, the melanocytes increase during that period. So that is
Oh,
why. So that
that's
is why
why.
you're getting, and and waxes and wanes. It's not there every time, but sometimes you know. So that is what it is. Even under stress and strain, you get it. Why periods? Even stress and strain, you will get. If you cry too much, you'll get. So many
Sleepless
things.
nights also we get.
So all those things is because this is the whole system is being disturbed. If you have proper sleep and proper set of mindset should be normal, happy, and always trying to remain happy. I know
Sure.
sometimes you're sad, sometimes your marks go down. Oh, why? Okay, this time it was bad. Next time I will improve. What is there? There's nothing. Marks doesn't make your life like that.
I'll get
Always.
back to that later, personally, Mama.
But
We'll
what
discuss
happens
that later.
when you get less marks? You should be encouraged to make better next time. That is what it is.
Moving on. Okay. Any questions? Anybody from here? You can put it on the chat if required, or you can send it to my phone also, so that if you really want it to be anonymous, you can always send it across to my phone. Otherwise, you can put it up on the chat. Any questions, anyone?
No, I'm happy that such a this platform is available for all of you. It's good because anonymity is very important, and these questions can be asked by anyone, for that matter. It's not that okay, Srila is asking me. No, the same question may be in the mind of others also, but they were not courageous enough or brave enough to put that question, whereas the other person has put. So it's okay. It's for the general persons, all of you who are attending, that I am talking. There is no such thing, oh, only this person asked, so there's some problem with that person. No, not at all. These are problems which come in the mind of every woman, girl, everyone. But only thing is that nobody was there to tell you or to talk to you about it. I mean, I'm telling you, my mother told me about the periods 1 year before the periods came. That such and such thing will happen. Don't be scared if the blood comes. And how did she recognize? Because she recognized my breasts were developing. So she thought, okay, maybe by next year or a year, she will have her periods. And she told me. For her, her mother had told. So, it's the mother's duty to inform the girls what all things happen. And then she takes it, and of course, we celebrate a lot that time. But nowadays, it's not that way. Everything new they get. So when
Yeah.
Maya got it, Srila felt why she did not get it. I said, when you get it,
Okay, let's not give out the family secrets here. This is not
no,
the
no.
family secret.
No, but what I'm saying is, it is they actually welcome that. The girls welcome that. Oh, it's something very, very this thing. But afterwards, they realize it's like, when you get this thing, okay, you're going to get married, you're so excited. Oh, it's something, which is happening, going to happen and all. But after marriage, we know what is normal and what is what all things can happen. So, but in any way, I would always say the person who can make or destroy the married life is the girl. Because certain things we have to talk it out, certain things we have to just digest it and for the sake of the family. That is because we have been given more of tolerance by God. God has given us more tolerance. That's why we can have children, carrying them for 9 months and then carrying on your, lap, and then like that up to the age of 3 years, you have to do with the child. Father says, hi, hello, how are you, beta? That's all. But the mother has to do everything. So God has given us that much of tolerance power, bearing power, all those things. So we always thank God. Yes, we are the people who brought the people into this world.
Okay, so there is someone who's written one moment. Ideally, we should have 6 to 8 hours of sleep, but many a times we cannot get that due to various reasons. My question is, what is the minimum amount of sleep that one should get for a proper functioning of body?
Actually, 6 to 8 hours.
Okay.
Like 6 to 8 hours, this is how, because what happens? How much, we should, supposing if you're sleeping at 10 o'clock, you should be able to get up by 6 o'clock. But during our studies, sometimes we get up at 4 o'clock. All those things. And you find how much disturbed we are when our sleep is not okay. But if you make it a habit, it's okay. But 6 to 8 hours is the normal allowed. Some people say, no, you should sleep by 8 o'clock and wake up by 6 o'clock. Nowadays, to sleep by 8 o'clock is not possible. But there are people who have their dinner by 6 o'clock or 5 o'clock and then they sleep by 8 o'clock and get up at 5 o'clock. So it's okay. It's how you deal. But yes, 6 to 8 hours is necessary. Otherwise, you will be feeling very tired. Sleep is essential.
Any other questions?
Hi, ma'am.
Hi, hello.
This is such a random question. I wanted to ask, there was some questions regarding thyroid. There is something called blood thyroid. So, how is that to be identified? Like, what are the symptoms with blood thyroid?
No, blood thyroid means, see, one is you feel very tired, fatigue, because the thyroid may not be enlarged, but you feel fatigued and tired, and you cannot attend, you are not attentive, all those things. So we do the blood test. Gentle blood testing the thyroid is also important. Then you continue because you're not very alert. All those things makes the doctor prescribe you to do these investigations.
Okay. For even that, we have to, continue the medicine lifelong.
If it is found to be that less thyroid or more thyroid, but it won't be more thyroid because if you're tired and all, it is always less. So then they will give medicine for that.
Thank you.
Welcome.
Any other queries? All right. Thank you. Please do fill in the feedback form, guys. It means a lot to us, and only so that we can grow better and we can do things in a much better manner. So please do fill up the feedback form. Thank you, Mama, for spending time out and,
I enjoyed it. I enjoyed
answering
it.
all our queries. Next week, we have a session on insomnia. So please do spread the word and how to handle insomnia. We have a doctor coming in and talking about it. You can ask your queries right then and there. Uh, so thank you so much, all of you.